अच्छा बच्चा कैसे हुआ? नॉर्मल डिलीवरी था या सी सेक्शन? It's one of those questions every new mom gets asked, and the answers, they're as unique as motherhood itself. Some births unfold with soft music and deep breaths, other with epidurals, surgical precision, or sudden surprises. But here's what truly matters: every birth story is valid, powerful, and deserving of respect. Welcome back to the fifth episode of The Care Circle, a podcast series by Motherhood Hospitals, where we bring real conversations and expert insights on women and children's health. I'm your host, Sneha, for today's episode. In our last episode, we spoke about the third trimester and birth planning. Today, we dive deeper into the modes of delivery to understand them better without judgment. Because whether it's a natural birth or a C section, what matters is making the right choice together with your gynecologist. Joining us today is Dr. Deepika Alva, consultant obstetrician and gynecologist at Motherhood Hospitals, HRBR Layout, Bangalore. With over a decade of experience, she's guided a lot of women through vaginal deliveries, assisted births, and even VBAC, always with a calm and compassionate care. Dr. Deepika, welcome to the Care Circle. We are so glad to have you with us today.
Thank you, Sneha. These conversations matter so much.
So, doctor, let's begin with the basics. When expecting parents come to you asking about delivery options, what are the main types they should know about?
There are generally two main types of delivery in pregnancy, as you're aware: vaginal delivery, Caesarean section. Now, vaginal delivery still gets further categorized into spontaneous vaginal delivery, induced vaginal delivery, or an assisted vaginal delivery using forceps or vacuum extractors. The Caesarean section similarly gets categorized into two: a planned elective Caesarean section or an emergency Caesarean section.
That's helpful to have that overview, doctor. I think it takes some pressure off when you know all the options exist for good reasons. Now let's start with vaginal births, doctor. I think many people think that normal delivery and vaginal delivery are equal. Are they different, do you think? And can you walk us through what spontaneous vaginal delivery means?
So both these terms, vaginal delivery and normal delivery, means it's a natural process of childbirth where the baby is emerging from the mother's body through the birth canal or the vaginal canal. These two terms are essentially the same, but from medical perspective, there's a slight difference. So normal delivery means it refers to vaginal delivery that occurs naturally without the need for any forceps or vacuum cup. So it's basically a natural, unassisted vaginal birth. As a vaginal delivery is a medical term for the process where the baby is born through the birth canal. It can be with the use of forceps or without it.
That makes more sense now. What about induced labor? I have heard mixed reviews about it. Some people think that it's more painful, some feel it's more unnecessary. Can you help us clarify when and why a doctor might recommend inducing labor instead of waiting for it to happen naturally?
So, induced labor means when a gynecologist, we help you start labor using medical methods rather than letting it begin naturally. So, it's typically done when there are concerns about the health of the mother or baby, and it's commonly done for reasons like high blood pressure during pregnancy, gestational diabetes, infections encountered during pregnancy, or a post-term pregnancy, or even for stalled labor, meaning the labor is progressing too slowly, or stops altogether. So, yes, induced labor can have a little more intense contractions than a natural labor. That's because it's starting off more quickly and it will be stronger right from the beginning. Whereas a natural labor, pains or contractions are building up gradually over time. Let's please understand pain is something very subjective and it varies from woman to woman, and pain management options are always available.
That's a great insight, Doc. I think many people don't realize there are medical reasons beyond just convenience. Now, when does an assisted vaginal birth becomes necessary, and how safe is it for both mother and the baby?
So, assisted vaginal birth. Now, this is a kind of vaginal birth where instruments like forceps or vacuum cups are used, and this is to guide the baby out of the birth canal. This is typically used when a vaginal birth is prolonged or when there are concerns about mother's or baby's well being. In situations like maternal distress, fetal distress, Prolonged second stage of labor, meaning the cervix is fully dilated and the baby is taking too long to come out, or if there is maternal exhaustion. Safety wise, yes, it is very safe.
I'm glad, doctor, you mentioned safety. I think that reassurance is important for parents to hear. Now, coming to VBAC, which is also known as vaginal birth after cesarean, this seems to be gaining more attention lately. Who would you consider an ideal candidate for a VBAC?
Patients who have given birth by cesarean section in the previous pregnancies can try to have a normal delivery in the present pregnancy. Now, this is what is called as vaginal birth after cesarean section. So, there are some factors contributing to selecting a good VBAC candidate. Primarily, history of one previous cesarean section and not more than that. And the cut that we give on the uterus should be something called as low transverse incision. Second, a spontaneous labor increases the chance of VBAC. Third, a history of previous vaginal birth. This is meant for patients if it is their third pregnancy where previous one delivery has been a vaginal and the second one has been a cesarean. Their chances for VBAC increases. If they have adequate pelvic size, and there's something called as inter-delivery interval, meaning an interval of at least 18 months is recommended between the previous delivery to the present one. The longer, the better. So these are some factors that we consider which will know that this candidate, it is a good candidate for VBAC.
That's really encouraging to hear that it's possible for many women, but I imagine not everyone can try VBAC though. Are there any risks associated with VBAC? And why can't every woman with a previous C section opt for it?
A VBAC definitely carries potential risks, and the most serious risk of it is uterine rupture. That means the scar from the previous cesarean section on the uterus, it opens or tears during labor. This is endangering both mother and baby, leading to increased blood loss as well as injury to other organs like bladder and the bowel, which might necessitate an emergency cesarean section in this situation. So, considering this huge risk, this is why all women can't opt for it. There are certain factors which increase the risk of VBAC in such women. Some things like multiple cesarean sections, the if there's any history of previous uterine surgeries, or the present pregnancy has some medical conditions which require the C-section. If it's a big baby, large for gestational age baby, advanced maternal age, significantly overweight women. Now, these are all risk factors where these kind of women can't offer a VBAC.
That individual assessment sounds really important, doctor. Can you also walk us through how a trial of labor after cesarean, which is also called TOLAC, is planned and assessed?
So, TOLAC stands for Trial of Labor After Cesarean. Now, difference between TOLAC and VBAC. TOLAC is a trial that we're giving to the women with a history of previous cesarean, attempting for a vaginal birth. If TOLAC becomes successful, then that birth is called as VBAC or a vaginal birth after cesarean. So, how do we assess women to go through stages of TOLAC? It all starts with patient selection, where we are considering individual risk factors and determining if the VBAC is a safe and appropriate choice for such women. We make the patient understand the potential risks and benefits of VBAC, help them make an informed decision about this mode of delivery. And it's also necessary for us to understand that we need to have a suitable healthcare setting where there's access to emergency care, including a surgical anesthesia team to manage all kinds of complications that we might encounter, and that effective maternal and fetal monitoring is required to detect any signs of uterine rupture.
That sounds like a very careful and measured approach, doctor. Have you had any successful VBAC stories in your practice that you would like to share with our listeners?
Yes, we've had an interesting kind of a story. I don't know what was successful, whether it was our attempt or the patient's. So there's a patient who was in ninth month, did have some medical complications and wished for going through a VBAC. We were still contemplating of seeing she's a good candidate for VBAC and we were yet to decide about it. But in the meanwhile, the patient set into labor, was at home, not monitored, and she landed up in our casualty at the very nth stage of her delivery, fully dilated and baby's head quite low down. She did deliver vaginally, but she did have some complications post that, some amount of bleeding and all of that, which we tackled. So, yes, effectively it was a successful VBAC. But then our question or the moral of the story is, was it an effective and a safe TOLAC, a trial? This is something that we don't encourage. Patients in labor with the history of previous cesarean kindly do not take the labor as lightly. Please reach out to the hospital at earlier signs of labor so that you're better monitored and safely monitored.
Very interesting story, doctor. Now let's explore a delivery method that's becoming increasingly common, which is called the C section delivery. Now, what's the difference between a planned C section and an emergency one?
So the main difference lies in the timing and the reason for cesarean section. A planned cesarean section is scheduled much in advance, usually before the labor begins. It could be for any factors like breech presentation, previous cesarean section, twins, placental conditions, certain medical conditions of the mother and baby in the present pregnancy. Now, an emergency cesarean section is performed when complications arise during labor. It requires immediate delivery. Situations like fetal distress, failure to progress in labor, cord prolapse, or sometimes conditions like or maternal complications like high BP, uncontrolled diabetes might need an emergency cesarean section.
This difference is very important, doctor. Now, there has been a lot of debate on social media lately about C sections done by choice rather than for medical reasons. What's your take on cesarean delivery on maternal request, or we can call it as CDMR, as it is known? Is it valid or something we need to be cautious about?
So, CDMR are cesarean sections that are performed at the mother's request without a medical or obstetric indication for this procedure. So, it's basically or essentially a cesarean section which is chosen by the mother even when we feel a vaginal delivery is safe for her. Her reasons could be multiple: desiring to schedule the birth, fear of labor pain, or concerns about any potential complications of vaginal birth. Regarding its validity, it's quite debatable issue in recent times. It's definitely not a standard medical practice and we do not encourage it. We are expected to counsel patients and then help them make a decision. Regarding decision to perform CDMR, it involves two things, I believe. One is the patient's autonomy, where she has a choice and to deliver in the way she wishes to. And as an obstetrician, I have a duty to do what is best for the mother and child.
I appreciate that balance perspective, doctor. In some cases, also family choose a specific date and time for delivery based on cultural or astrological beliefs, which is also called as muhurtam deliveries. How do you approach these requests as a clinician?
So, scheduling a delivery, usually a cesarean section with specific auspicious time based on astrological advice, muhurat deliveries. Definitely not based on the obstetrician's advice. So, there are certain risks in it because it's a surgery, definitely, and generally not recommended to have such muhurat deliveries. But if still a woman wants to have a planned delivery, we still would recommend them to wait at least till 39 weeks of gestation so that the baby's lungs and other organs are fully developed, not before it.
That sounds like a so thoughtful approach, doctor. And then, how do you strike a balance between respecting a mother's or a family's personal preferences and ensuring safety through medical guidelines when planning for a C section?
There are certain steps to balance the patient's preferences and the medical guidelines. First and foremost, let us understand the reasons as to why a woman is choosing cesarean section over normal delivery. Is it because of the pain factor during labor, or is it because of previous birthing experience which was bad, or is it a personal factor? Once we understand the reasons, it's necessary then for us to provide accurate information regarding these things. Discuss with her the alternate options like pain relief methods during labor. If a woman still prefers cesarean section after thorough discussions and if it's aligning with our medical guidelines, then it can be considered.
Now, there's so much chatter around C sections, and some of it is helpful, but a lot of it is also confusing and scary. Let's do a quick round of myth and fact to clear the air for our listeners. I will read out common beliefs and you will tell us if that's true or not. C sections are easy way out, doctor.
False. Cesarean sections are definitely a major surgical procedure and not an easy way out of childbirth. They involve surgical risks and longer recovery period. So but it's not a simple alternative to vaginal birth.
If a woman has a C section, she can never deliver vaginally again.
VBAC is always a possibility. While a VBAC may not be possible option for all women, it is still considered.
A woman can plan a C section just for comfort or to avoid labor pain.
So, while some women may choose an elective cesarean section for convenience or to avoid labor pain, it is generally not recommended for non medical reasons, especially if there are no complications within the pregnancy.
C section recovery is always longer and more painful than vaginal birth.
So, pain wise, it is not always the case that they are more painful, but being a surgery, yes, the pain levels are more than in a vaginal birth. But again, pain levels are subjective. It depends on our overall health, the complications, and the various types of pain management methods that we provide. It is something that varies from person to person. Recovery time, yes, it is longer than a vaginal birth.
A mother can't bond or breastfeed immediately after a C section.
False. Mothers can absolutely bond and breastfeed immediately after C-section. While there may be some temporary challenges, it is generally possible to start breastfeeding soon after birth while you're still in the OT or recovery room.
Those clarifications are so helpful for our listeners, doctor. Thank you so much. Now, many women today ask for natural births. What exactly does that term mean from a medical perspective?
So, natural birth is a childbirth with minimal or no medical intervention, such as induction of labor pains or pain medication methods that we give during labor. So, it's basically a physiological process where you're dependent on the body's capacity to deliver the baby. We're emphasizing more on body's natural coping mechanisms during labor and delivery, especially for pain relief techniques. That is, breathing exercise, relaxation methods, massage, movement. So this is natural birth.
That's a much clearer definition than what we usually hear. There's also curiosity around pain free or painless labor. Could you explain what an epidural is and when it's typically administered?
So, epidural is a technique of pain relieving medication is injected into a space around the spinal cord. Now, that is called as epidural space. What it does, it blocks the pain signals to the brain. So, this allows women during labor to remain comfortable, where she will feel her contractions, but they just won't hurt. And epidurals are generally given around 3 to 4 centimeters dilation, that is in active labor.
That sounds very reassuring, doctor. There are so many mixed opinions around epidurals. Now we are going ahead with another myth versus fact round, doctor. Are you ready?
Yes, Ready Sneha.
A woman is not strong if she asks for pain relief.
This is a harmful myth. A woman's strength is definitely not determined by whether or not she chooses pain relief. It's completely a personal decision based on her pain tolerance, preference, and our medical advice.
A woman can only get an epidural at the start of labor.
That's a myth. Epidural can be administered at any point during labor, like at the start or in the middle of labor. There may be a few situations where an epidural would not be an option, like if the baby is about to be delivered or if there are some specific medical contraindications.
She can't feel or push during delivery if she takes an epidural.
While epidurals can reduce the sensation of pain, they don't necessarily eliminate all the ability to push. We will be able to adjust the dosage in such a way that she has pain relief, but while still enabling her to feel the contractions and push when needed. Definitely with the support from the nursing staff. There's no such evidence to say that they increase cesarean section rates. If a cesarean section is anyway needed, it is for other complications which is unrelated to epidural.
Thank you so much, doctor, for clearing that up. Those myths really needed addressing. Now, talking about the labor room experience, what role do different labor positions like squatting, cat cow, or using peanut balls play in easing labor?
So we have different labor positions which help to ease labor. Uh, Amongst them, it is the upright positions like standing, walking, squatting. These positions help to promote fetal descent by increasing the pelvic opening and reduces the mother's back pains. Then there are other positions that support the mother and baby, like hands and knees or all fours, it's called as, kneeling down, sitting on a birthing ball, or side lying with a pillow in between. These also help to rotate the baby and open the pelvis and help in the baby's head descent.
That's fascinating, doctor. But is it true that while positions can be varied during labor, the final birthing stage happens in the conventional position?
Yes, the final stage of birth, which we call the expulsion stage, is often associated with a conventional position. That means the mother is lying on her back or semi reclined. But there can be variations in this position. While this back lying position is quite common, they can also choose to sit or squat for delivery purpose as long as the obstetrician is comfortable and it allows for a safe delivery.
That flexibility during the processes sounds so important. Now, speaking of planning, how important is it for expecting mothers to create a birth plan and what should ideally go into one?
So, what is a birth plan? This is a way for patients to communicate their wishes to the doctors during the labor and delivery process. So, this is like creating a birth plan. It helps empower a woman because she's informed of all her choices and options during labor. And these are best suited for low risk pregnancies. Now, what should a birth plan include? First thing, who would you like to be present in the room, the delivery room? That is your support people. Your pain management options. Are you looking for natural techniques or epidural? Delayed cord clamping, skin to skin contact of the baby, which is already done by most of us. And the need for episiotomy. Some patients may not want an episiotomy, so we can have a discussion on that. So these are things that gets included in a birth plan. But please understand flexibility is the most important aspect of your birth plan because in labor and delivery, things always don't go the way according to plan and situations change quickly. So birth plan must come with an open mind.
Since, doctor, you said that things don't go according to the plan, how do you prepare a mother emotionally and mentally for such changes in delivery mode?
So it's crucial for us to provide them education, emotional support, and practical strategies. So we're generally making them understand the labor process, the delivery process, and the postpartum period, how it looks. This helps them reduce anxiety and uncertainty with the entire process. Help them make a birth plan, understand their preferences. They should have a sense of control over this entire process. Keep an open communication with the mother and the husband. Give them reassurance, encourage, address their fears, and please let us set realistic expectations. We have to make them understand that birthing is unpredictable and things may not go as planned. And this helps them to manage their expectations as well.
Now, that shows communication sounds crucial. Recovery isn't just physical, it's emotional too. So, doctor, how important is the husband's role during the recovery phase, especially after different modes of delivery? Are there specific ways they can support the new mother better?
Yes, a partner's role is very important. They should provide the emotional and practical support to a new mother. Emotionally, yes, please recognize and understand that postpartum period is physically and emotionally very challenging. Provide an active listening and provide comfort. Coming to the practical assistance from the partner, start helping with household tasks, running errands of the house, baby care like diaper changes, bathing, soothing of the baby, allowing mother to rest and recover. Let the mother have her breaks, relax, and focus her own well being, encouraging her to eat healthy and rest. Please limit the number of visitors. And this is a very important thing. Please recognize the warning signs of postpartum depression.
Those are some practical tips we got from you, doctor. Thank you so much. Now, every mode of delivery comes with its own healing journey. Could you help our listeners understand what recovery looks like after each birth, whether it is vaginal birth, C section, or even VBAC? Are there any key differences or tips you would suggest?
So, recovery experiences will vary depending on a vaginal birth, VBAC, or a cesarean section. Vaginal birth and VBAC are essentially almost similar, and cesarean section is slightly different. So, the recovery experiences will vary after vaginal birth, VBAC, and cesarean section. But VBAC and vaginal birth are almost similar experiences, whereas cesarean section is slightly different. Considering the hospital stay after a vaginal birth or a VBAC is generally between 1 to 2 days, whereas for a cesarean section it becomes 2 to 4 days. The recovery for vaginal birth and VBAC happens within 6 weeks. For cesarean section, it takes slightly longer, somewhere around 6 to 8 weeks. So, what are the common issues that we encounter post vaginal birth or VBAC? It could be usually perineal discomfort and some vaginal bleeding. Whereas for a C section, it is going to be pain at the incision site, the potential risk of some infections, and definitely longer period of limited activity. What tips can we provide for all these recoveries? Please prioritize sleep, relaxation so that your body can heal. Healthy diet is very important. Stay hydrated. Follow the pain management recommendations that we provide. Watch for infections and please seek help and emotional support whenever needed.
This is helpful to set proper expectations. It sounds like each journey is truly individual. Your birth experience is yours, whether it unfolds exactly as you planned or takes completely unexpected turns. Both can be beautiful, both can be challenging, and both lead to the same incredible moment meeting your baby. If today's episode helped ease your decision making stress, we are glad. Thanks for joining us on the Care Circle. Follow us for more conversations that honor the real, messy, beautiful experiences of parenthood. Until next time, stay healthy and take care.